Hello, everybody. We have been discussing a lot about music, brain, and emotions. In this topic of today, I would like to ask Dr. Anil Sangli whether music helps in releasing or reducing stress. If so, how? Dr. Anil Sangli.
Hi, hello everybody. We have been discussing about the power of music, and today I would like to bring to the viewers about how music helps in reduction of the stress. Well, a very common thing that everybody knows is when they're really stressed out, they want to hear to some good music, and that's been there from ages. But will it really help in reducing the stress, or is it just your fad that it's happening so? That's very, very important because we need to have some scientific proof that there is a reduction in the stress when you listen to music. One thing is very sure, the subjective feeling of a reduction in the stress is very, very common, and that too in patients who are really stressed out when they like music. Patients who do not like music at all, that's a different ball game altogether. And in some such patients where they listen to music, they feel more alert, they have a lot of concentration. And when you listen to music, which has got some 60 to 65 beats per minute, it is very, very common that such patients get a very good relief with stress because that sort of a slow tempo music will create certain types of alpha rhythms in your brain and it will make you relaxed. And at the same time, if you want to sleep off, it helps so. And if he doesn't want to sleep off, he's more alert, then his awareness will also improve. That is the power of music, and it's very clearly depicted in various studies that alpha rhythm improves with relaxation, and that too with beats of music of around 60 beats to 65 beats per minute. The tempo, which I'm telling you.
Yeah, Doctor, we are talking of various types of impact music has on the brain and the emotions. And today we are discussing the impact of music on the condition of stress. Normal people can cope up with a lot of things, that is, people who are young, who are energetic. But there are certain kinds of people who have stress which has been induced from outside, or if there is injury related stress or disease related stress. Will music help in these conditions too?
Certainly. When you talk of disease, it may be a physical ailment, it may be a mental ailment. Physical ailment in the form of a trauma to the body, or it may be sort of a cancer, or it may be just sort of diabetics or hypertensives who have some of the other sort of problems. They may have aches and pains and they may not be normal all the time without any pain or without any problems at all, or they may have some gastric symptoms, they may have some pains in the neck or the back, which is all very common nowadays. And very other important common problem is an obesity, and they put on weight, and that relates to various other problems with the pain in the knee joints, the back pains, neck pains, etc. So in such patients, and in patients who have actual mental problems secondary to their physical ailment, like for example, when there is a chronic pain or when there is a chronic stress with respect to some physical ailment, they go in for a lot of mental depressions or anxiety features. And in such individuals, the music definitely helps. There are a lot of studies that have been done in patients who got cancer, in patients who got chest pains, cardiac problems, neurological ailments, patients who got problems with relation to strokes or neurological ailments secondary to some injuries or a cancer or any sort of a thing. Or it may be just anxiety related or psychologically ill because of some problem in the family, or it may be in the form of depression. They keep on crying all the time, and they're not at ease mentally, and they're not they get very irritable, agitated for small things. Or it may be in the form of a menopause, or both in males and in the females there can be some sort of a hormonal change during midlife, or the midlife stress itself can cause a lot of problems. In all these patients, music definitely helps. It depends on what type of music is given, what type of individuals they are, what type of problems they encounter. So if it is a problem with anxiety, it's a different type of music. If a problem with depression, it's a different type of music. Or if it is sometimes lyrical content also helps, especially certain patients who are spiritually oriented. When you tell them to listen to some songs which give them sort of a solace, when you especially in Carnatic music and in Hindustani music, there are certain types of slow tempo songs along with some very good lyrical content, especially the Dasara Padas, they have a profound effect. See, the effect of music, the effect of the rhythm, the effect of the pitch and the loudness, and the lyrical content, all of them will probably accentuate with each other, and they can have a lot of benefit out of this.
Doctor, you told just now how music impacts, and there are elements of music which includes the loudness, pitch, etc. For example, I don't have anything related to music as the lyrics. I don't have any voice to sing. I don't rely upon any beats or rhythms or whatever it is, and I don't know the pitch. In these cases, are there any instruments that can help people, especially those who are ailing? And why I'm asking this is, we have what is called as the drone, that is the Tanpura. If I hear only the Tanpura, which doesn't have any element of whatever we are talking of musical elements, will it have an impact? And if so, will it have an impact on people who are ailing?
It's an excellent question, Sripad, because see, Tanpura, as everybody knows, has got 4 strings. You have a male Tanpura and a female Tanpura. That depends on the type of the pitch which comes in through the Tanpura. It's a very simple construct. It actually forms a base or it's also called an Ardhaswara base, where they can listen to this, which creates an ambience in the whole stage. And with a single Tanpura, you can actually elicit all the Saptaswaras, all the notes. And there are certain notes which are more prominent in them, and certain notes which are very subtle. But nevertheless, a well-tuned Tanpura, you can elicit all the notes. And it is left to the person who really listens to it with a lot of intent, who can make out all the different swaras in the Tanpura. And the relation between Tanpura and the mind is very, very close, because the brain and the mind, both of them react to the Tanpuras. The brain, in the sense, what I'm telling is the structural aspect, what we see. The mind is something just like an electrical activity which we don't see, but we have a mind. And the mind and the brain, both of them react to Tanpura. The mind, in the sense, you will listen to these type of sounds. Can you see the sounds? No. It's an abstract form. Those abstract forms will affect on your mind. That is also abstract. And the physical form, the actual Tanpura which you see, that acts on the various types of neurons through your auditory system. When it goes to the auditory system and you listen to those things, there are certain types of cells which get stimulated by this. For example, every swara, sarigama padani, all of them will elicit certain types of neurological stimulation in the brain in specific areas. Each and every tune will have some reaction on the nerves. And if you combine those tunes, like for example, if you say only sa, or only sa and re, and sari and ga, and a combination and permutation of all these things, all of them will have specific impact on certain groups of neurons. And that also depends on the way it is sung, the melody, and all those aspects. So when you just listen to the Tanpura, it actually retrains the mind to great extent. That is, the physical structure of the brain also changes, the mental aspect of the brain changes, and they start releasing different types of hormones, like the feel-good hormones, which we have told last time, like the serotonin, the dopamine, the oxytocin, and all these hormones, and it reduces the cortisol levels. Not only in the brain, but also in the whole body, the cortisol levels reduce. And that's how just listening to the Tanpura helps. You remember, we have done so much of music on certain just young kids who are very, very autistic.
3 or 4 year olds.
Autistic, and in young kids who are very restless, irritable. All of them calm down within 3 to 6 months just by listening to the Tanpura.
On a daily basis.
One more important thing, Sripad. Professor Michael Bellam of the Utah State University has done an excellent study on repetition of music. In Indian music, especially in Hindustani and in Carnatic music, or whatever type, even in filmy music, there is repetition. The same thing is repeated twice or thrice. He has found that the human mind shuts down after 3 or 4 repetitions of a particular rhythm or a melody or a harmonic progression. This repetition of the music will reduce the stimulation in the brain, and it will cause some sort of a relaxation.
Okay.
And that relaxed effect, along with the proper rhythm, melody, and the lyrical content, the effect is profound. In the last session, we had talked about Om.
Yeah.
We will play the Tanpura in a particular Shruti and recite the Om and see how it helps. Did you notice?
Yeah, it gives a sense
What
of
we did?
calmness.
Gives a sense
So
of calmness,
and a soothing.
we just took one single breath, and till the end of the breath we could hold for probably 20-25 seconds. We can even hold more. If you are on an empty stomach, you are sitting early in the morning, do some deep breathing exercise and then do this, you may increase your capacity of your lungs. I would like to bring in one patient who had a lot of problems. She is a 75-year-old lady
75 plus.
plus, and she has multiple problems. She is one of our first patients. She has diabetes, she has hypertension, she's obese, she has had multiple surgeries earlier, and like gallbladder surgeries and other things. She has got two separate cancers, both of them treated by surgery and on chemotherapy and other medications.
And the first
And-
surgery twice. For the
Yeah,
same-
twice for the same thing, and again the another surgery twice. I would like her to come and say, but she doesn't want her identity to be revealed. And her lungs were very bad. She had a lot of dyspnea, and by the time we found out that she had such a problem, it was so bad that it had aggravated to such an extent she was not able to sit or walk a few steps without having any problem with breathing. And not along with the medications. I'm giving a disclaimer here. All the musical therapeutic effects which have are all
Adjuvant.
complementary. It is adjuvant. The main treatment has to be done, and it accentuates or improves the process of the recovery. And for this patient, we made her sit every day at least for about half an hour to 45 minutes
In the
twice
morning.
daily.
Morning and
sometimes she used to
45
miss out
minutes in the
evening.
evening.
And she used to sit straight and say the akara and the ukara and the makara continuously, and do some deep breathing exercises and little bit of steam inhalation, and then make her walk. And lo and behold, after about 8 to 9 months, the chest improved to such an extent that she is able to walk around on her own. Of course, with a walker and other problems. She has other problems with the knee joint and other things. She has no pain now. She has no dyspnea. She has no problems with normal talking and normal activities. She can do all her normal daily household activities without any significant external support.
And she is alert.
She is extremely alert, and her memory is better than our memory. And really, and this patient, I would like her face will not be disclosed. You will be listening to her voice. You will be listening to the way in which she says the akara, and this is only just to tell the viewers and give a stimulus for all the persons.
You need not
who are-
worry about, or you need not worry.
Exactly. For patients who are having a physical problem or a mental problem, they can definitely recover. It is only the mental attitude of the persons and the capacity for them to recover will increase with music.
See, you need not have a negative attitude even if you suffer from worst of the worst diseases. If you have a positive attitude, you can recover very well. And this 75 plus year old lady has been doing this akara along with Tanpura for nearly 4.5 years. And she is very aged, but she's coping up so much. And this is being provided on request that it should help so many other people too. And as
Please
Dr.
don't
told,
get into depression. Please don't get into any sort of a physical or a mental. All of us have problems, but it is the way in which you cope up with the problems and to overcome all those things which matters.
and she had a lot of family problems at a very old age. The normal thing which happens in every home, I need not express that. And even with that condition, she has been coping up so much. And this is given as a stimulus, social stimulus to many people who feel that my world is gone, I don't have anything to live upon, and there is nobody to help me. These sort of negative attitudes should go. And this lady is a living example.
You please listen to her, the
Way of
way in
singing.
which she sings. Of course, because of her age, there's a lot of tremulousness, but nevertheless, you please listen to this.
And we have given instrumental music also to her,
Yes.
along so that her voice stabilizes. So she'll be singing a bit of lyrical content too in this. So please watch this.
ತೋರ್ತ ಸಜ್ಜನ ಸಾಧು ಪೂಜೆಯ ವೇಳೆಗೆ ಮಜ್ಜಿಗೆಯೊಳಗಿನ ಬೆಣ್ಣೆಯಂತೆ ಭಾಗ್ಯದ ಲಕ್ಷ್ಮೀ ಬಾರಮ್ಮ. ಸಕ್ಕರೆ ತುಪ್ಪ ಕಾಲುಗೆ ಹರಿಸಿ ಶುಕ್ರವಾರದ ಪೂಜೆಯ ವೇಳೆಗೆ ಅಕ್ಕರೆಯುಳ್ಳ ಅಳಗಿರಿ ರಂಗನ ಚೊಕ್ಕಶಿ ಪುರಂದರ ವಿಠಲನ ರಾಣಿ, ಚೊಕ್ಕಶಿ ಪುರಂದರ ವಿಠಲನ ರಾಣಿ, ಭಾಗ್ಯದ ಲಕ್ಷ್ಮೀ ಬಾರಮ್ಮ. ಈ ದಿನ ಬೇರನ ನೀ ದಿನ
ಬೇರನ ಮುರೆ ಬೇರನ मोर जिया घबरा
ನಾಮವೇ ಚಂದ ಅದನಂಬಿಕೋ ಕಂದ, ಹರಿನಾಮವೇ ಚಂದ ಮಣ್ಣಿನ ಹಾಗೆ ಮಾಗಿಸೆ ಮನವ ಚಿನ್ಮಯವೆಂಬೋ ನಾಮದ ಜಲವ ಸೇರಿಸಿ ಬೆರೆಸಿ ಮುಕುತಿಯ ಬಯಸಿ ಗುರಿ ಸಾಧಿಸೋ ಕಂದ, ಶ್ರೀಹರಿನಾಮವೇ ಚಂದ.
Hope viewers, you have listened to this, and let this be a stimulus to one and all. And this being the time of Diwali or Deepavali, let us spread the awareness that there are positive things in life. It's not only the diya which we light up or keep in front of our homes. It is our own bodies which we have to light up, our own minds, and that includes knowledge. We have to have a lot of knowledge, we have to be aware, and we have to remove our negativity from within our minds. And hope you not only enjoy this but also spread this knowledge to many other people also to whom you know, so that let the lights of each and every person in the whole world, this is Vasudhaiva Kutumbakam, let all our homes and our minds be lightened up through this awareness and knowledge. What do you say, doctor?
Yes, let the darkness of depression go this Diwali,
Negativity.
and let the lighting up of all
Negativity,
the
let it
positive
go.
thoughts come to everybody's mind.
Yeah.
Thank
So it
you.
was
Thank
very
you
nice,
so
doctor.
much.
Thanks for
Thank you, everybody.
giving this scientific basis of this, and hope viewers also enjoy this. And we'll be bringing some more of these types too for the viewers. And I thank Dr. Anil Sangli once
Thanks,
again.
Sripad, and thank you, viewers.
Thank you.
so
Thank
much
you so
again.
much.